In this advanced technological era, we tend to have less tone of the muscles because of less physical activity. That puts more load onto our spine. Many a time, if you take a complete bed rest, the pain will subside by the natural inflammation subsidence and healing process. Hi friends, this is Dr. Vikram, Head of the Department, Senior Consultant Neuro Surgeon from Department of Minimally Invasive Brain and Spine Surgery, Sri Ramakrishna Hospital, Coimbatore. Let us know about our spine and the treatments available for spine. We have 7 cervical spine vertebra, 12 dorsal spine vertebra and 5 lumbar spine vertebra and 5 sacral vertebrae. This is the base bone of all our erection posture from animals. The evolution has created the variations in the joints of the spine which happens in the back side. The weight bearing happens through the front, but the stability of the spine happens by the joint and the muscles and tendons happening in the back side of the spine. So with evolution, as we being a vertebrate and we have started standing, the curvature of the spine happens to get the gravity to the center of the body so that we can see, observe, work more comfortably, unlike the animals. So along with that, we do get the problems what we face because of the evolution. We have not been designed basically for high speed work, high load work by the God. But when with the technology, with the advancement in all our regular lifestyles, we put more stress on our spine and we have very less take on maintenance of the spine. From our ergonomics, how we sit, how we work, how we lift, how we do our daily lifestyle work activities. By all this, we put more and more strain on all these joints as well in the front of the spine, including our weight gain, our abnormal posture when we are sitting, standing, working, puts more strain on the spine. Apart from the spine, the muscles in front from our abdominal muscle, chest muscles and back muscles have a role. Once all these muscles grouped are trained and toned, half of the load is taken off by the spinal column and half by these muscles and ligaments. But in this advanced technological era, we tend to have less tone of the muscles because of less physical activity. That puts more load onto our spine. So what this causes, like anything which you use more will have more tissue damage or wear and tear. So the same way in the spine, in between each vertebral body, there is a portion called disc, which is something like a gel or a gelatinous structure. This takes care of friction, shock absorber like feature given by the God, so that the movements doesn't affect each bone over the other bone. But as we work more, as we put more stress, more strain, abnormal posture and whatever we discussed, that puts more damages to all these discs. And because of this curvature, the load and the damages happens at particular regions of the spine much more than the rest of the spine. Like in cervical spine, we have more damages close to C4, C5, C5, C6 than the rest of the spine in the neck. The same way, the entire load is borne and there is a curvature in the front side of the lower spine, which puts more pressure on the L5S1, L4-5 disc spaces than the rest. Apart from this, the degeneration is nothing but a part and parcel of our aging. The supple bone becomes hard, the supple ligaments and capsules become hard, which are in the backside of the spine. You can see these two joints, they are covered by capsules and ligaments. So these get more stress. To control this stress, the bone becomes hardened and there will be abnormal growth in that area called osteophytes. This makes this joint more harder. So both the joints and the discs becoming harder are prone to damage. So when we have a small fall or a weight lifting or a traveling in a very bad road or an abnormal postural sleep, any of this can trigger this damaged disc to bulge behind and press the roots, which is coming out. You can see here, this is our normal spinal cord, the nerve structure which is traveling from the brain down to the spine, and you have right side nerves, left side nerves. In the lumbar spine, in 5 vertebrae, the top 1, 2, 3, 4 supplies the anterior side of the limbs, and the lower side supplies and takes sensations from the back side of the legs. So depends on which part of the nerve, which level of the nerve is getting compressed, patients will have symptoms where the pain comes from back, goes right down up to the leg. Depends on which nerve is getting affected. Though this is a continuous process, the trigger factors usually will happen after a weightlifting or a fall or some abnormal movements. So the degenerated disc, when it protrudes and presses the nerve, the pain starts. Many a time, if you take a complete bed rest, the pain will subside by the natural inflammation subsidence and healing process. At the same time, when the bed rest is not helping, analgesics, the painkillers are not reducing the inflammation, then the patients need a next level of treatment. It is, we can give a epidural steroid. That means a small doses of steroid is given around the inflamed area by epidural injection. It can be simple epidural or it can be caudal epidural. The different modality of giving the same drug to the required area. So this reduces the inflammation which happens around the degenerated protruded disc, will subside the pain. Once the pain subsides, then we offer them physiotherapy, lifestyle modification to make sure the patient doesn't get back all these problems again.